This video is brought to you by the Southwark Enhanced Intervention Service. This video will focus on managing risk. So what is risk? Risk is all around us. It is a situation involving exposure to danger or the possibility of something bad happening. When we assess risk, we think about risk factors and protective factors. Risk factors are any factors that might increase risk, whereas protective factors prevent or reduce occurrence of risk. Risk can be minimised, but it is important to remember that it can never fully be eliminated. Risk is fluid and can change, sometimes over very short timescales. Today we will be thinking about risk in relation to people engaging in behaviours that challenge. Let's have a look at the different types of risk behaviours. We usually categorise them as risk to self, for example, biting self, scratching self, or self-neglect. Risk to others, for example, hitting, biting, verbal abuse. And risk from others, for example, physical abuse or neglect. Take a moment to think about why people with learning disabilities or autism might engage in risky behaviours. There are several different reasons why people engage in risky behaviour, and often they are linked to our basic human needs and desires. If we are able to try to understand why these behaviours occur, we will be in a better position to stop or minimise these behaviours and the risks they pose. Communication is one of the most important ways in which we control our environment and influence other people. If a person's impairment in communication limits this control, frustration or anxiety are likely, and behaviours that challenge may follow. If such behaviour is effective at getting what the person wants or needs, it may be more likely to occur again in the future, and as such becomes a learnt way of getting their needs met. People with an LD or autism may have a sensory dysregulation. Such sensory problems may be the underlying reason for some behaviours, for example, rocking, spinning, or hand flapping. People with a learning disability or autism may find the world a confusing and unpredictable place. They have specific difficulties with things such as social imagination and social interaction that mean that they can be prone to negative emotions, such as higher levels of anxiety. People can sometimes engage in behaviours that challenge in order to escape from these difficult feelings, particularly when they don't have the skills to manage this independently. Furthermore, people may engage in risky behaviours as a response to life events, such as trauma or negative experiences, physical health problems or pain, restrictions at home or in the community, loss or lack of control in daily life, lack of stimulation, feeling misunderstood, change in routine, reaction from others, unmet needs, or life transitions.
As we mentioned, experiencing difficult emotions can be one of the possible reasons people engage in behaviors that are risky. Anger is one of the most commonly perceived emotions related to risk, but most of the time, anger is the surface feeling, a secondary feeling where there are a lot of feelings that lie underneath the anger and in some way then cause the anger. One common feeling that underlies anger is anxiety. Engaging in risk behavior can be a sign that something is wrong that the person you support cannot express in another way. The anger iceberg analogy can help to understand how other negative feelings lie underneath the anger. When people display anger, there are usually emotions hidden under the surface that drive this behavior. For example, embarrassment, anxiety, worry, or sadness. These feelings might cause a person to feel vulnerable, or they might not have the skills to manage them effectively. It's generally easy to spot anger, but by exploring what's beneath the surface, we can gain insight into what is causing the angry behavior and therefore what might help the situation. As we said earlier, people often engage in behaviors that are risky in order to get their needs met. Needs are not just the basic physiological things such as food, water, warmth, rest, and safety, but include more complex psychological needs such as love, social interaction, feeling a sense of accomplishment, and contributing to the world. The hierarchy of needs is a model that outlines these different levels of need. The more basic needs are at the bottom, and once these are met, the model suggests that then people's psychological needs will need to be met. And finally, the top is the self-fulfillment needs, which can be met once the basic and psychological needs are met. It is worth noting that all behavior has a function, which is to say that the person gets something by engaging in the behavior. The function of a behavior might be to get access to something, to escape something, to get sensory stimulation, or to get relief or escape from a negative emotional state. For more information on this and how to manage behaviors that challenge, see our positive behavior support video.
Learning disability and autism services can support people with behaviours that challenge to help manage the risk and think about what can be done to reduce the risk. In the Southwark Enhanced Intervention Service, we gather and collect information through observations, talking to carers and the wider network. We complete assessments, repeating them over time to identify change. We formulate the behaviours to complete risk assessments and develop risk management plans on crisis plans. We develop guidance and individualised strategies to meet the person's needs. We provide bespoke training with a focus on reducing restrictive practice. And we take positive risks when appropriate. Let's have a closer look at what sorts of strategies might help. We have two types of strategies: proactive strategies, which are things to be done before the risky behaviour has occurred, and reactive strategies, which are things to do once an incident has occurred. Proactive strategies are things to do every day when supporting the person that improve the person's quality of life and meet the person's needs so that they don't have to engage in the behaviour that challenges. These strategies aim to reduce the anxiety-provoking situations and therefore the person's feelings of anxiety and distress. They are strategies for long-term change and can include changing the environment, physical and social, teaching skills, and reinforcing positive behaviours with the aim of increasing quality of life. Reactive strategies are things that should be done after the behaviour has occurred. These are strategies that enable an immediate response to behaviours to de-escalate the person you are supporting and to remove the trigger or meet the need or desire of the person. They aim to minimise the risk in that moment and keep everyone safe. Reactive strategies will not result in any future change in the pattern of a person's behaviour. Their goal is simply to help carers achieve fast, safe and effective control of challenging behaviours and risk. Reactive strategies must never be used on their own, but should instead be employed within the context of an overall positive behaviour support plan. Take a moment to think about what strategies have worked for the person you support.
Let's have a look at some possible proactive strategies to minimize risk. Plan your day and activities. Routines can help people to understand what is expected of them in specific environments and situations. Well-established routines can help to reduce a person's anxiety as they can be confident in knowing what will happen next, how people around them will behave, and what they will need to do. Prepare for change. Sometimes things might not go as planned, and it is good to have a backup plan and be aware of the best way to explain this to someone. Remove non-stressors. from the environments people are in. This can include sensory stressors. Know and consider your environment: noise, temperature, light, space, people present. Positive phrasing. Provide clear and simple instructions and keep your language positive and praising. Break down activities and information into smaller, more manageable chunks. Foster independence and skills. Proactively teach people skills for independent living so they don't have to rely on you as much to get their needs met. Offer choices, and only choices that are available. Use visual supports and schedules. By having a choice, people will feel more in control of their environment. This can help reduce anxiety about what is happening around them. Some people might find it helpful to have a visual prompt. This could be pictures, photos, or an object that the person closely associates with the activity. This can be shown or given to them before starting the routine. These are just some examples, and it is important to use strategies within your crisis plan and behavior support plan. Remember, sometimes less is more, and consistency is key. Now, let's think about some possible reactive strategies. That is, things to do to minimize the risk once a behavior has occurred. Try to meet the need if appropriate, sooner rather than later. Remove the trigger if possible. Redirect to a known available interest. Consider calming activities. Provide space. Ensure your own safety. Contact person, safe words, know your exit, exit if you can. Use emergency services. These are just some examples, and it's important to use strategies within your crisis plan and behavior support plan. These are some of the things that we would suggest avoiding when supporting someone who displays risky behavior. Telling someone to calm down, putting yourself in danger, offering an activity that is not available, mirroring their behavior, shouting when they are shouting, placing demands on them or using a lot of verbal directions, overcrowding the person. As we mentioned before, risks can never be fully eliminated. They will never go away, but they are fluid and can change, sometimes over very short timescales. That means that the risk of the behavior escalating can remain even when someone seems calm. It is also worth of note that if you have been involved in a risk incident, you may need a break and may need to ask someone else to take over from you for a period so you can have a rest. If someone has to manage several incidents of behavior that challenges in a short period, there is a risk they will burn out.
Some actions that can be helpful after an incident include giving the person you support more space or time out, engaging the person in a preferred activity, preferably a low-demand activity with few verbal instructions that is familiar to them, changing the environment if appropriate, not making or setting up demands, ensuring yours and the person you support's physical and emotional safety, for example via physical checks or supportive or reassurance giving. Changing roles, allow someone else to step in and care for the person if that's possible. Gain immediate medical checks and emotional support for anyone involved. That includes you. A physical intervention is any method of responding to challenging behaviour which involves some degree of direct physical force to limit movement. There are three broad categories of physical intervention. direct physical contact between the carer and the person with challenging behaviour, for example holding down their arms, the use of barriers to limit freedom of movement, for example locked doors, the use of materials or equipment to restrict or prevent movement, for example the use of arm splints. Along with this, there is also chemical restraint, which is the use of medications to calm or influence a person's behaviour. There are legal frameworks in place to protect people from harm. This includes people with learning disabilities and autism. You need to be aware that criminal liabilities can occur when using physical interventions, and that physical intervention may breach human rights. Physical intervention may be necessary in certain situations when, despite other measures, a significant residual risk of harm remains. For example, if someone is harming themselves or would cause significant injury if they were not stopped. If someone is harming someone else, including you, and would cause significant injury if they were not stopped. The decision to teach physical intervention and the scope of such training needs to be underpinned by an objective assessment of the risks. These practices should always be the last resort and should be used as little as possible. The TINA principle states that physical interventions should only be used when there is no alternative.
So to summarize what we have covered in this video, a risk is a situation involving exposure to danger or the possibility of something bad happening. Level of risk can be minimized, but risk can never be fully eradicated. Risks can be recognized, assessed, and managed as much as possible. Risk is dynamic and occurs in a context. For example, interaction between the individual, the situation, and the environment. Therefore, the assessment is an ongoing process. It is important to recognize that risk factors will vary in significance for everyone as their circumstances change. Effective verbal, visual, and written communication is fundamental to risk minimization. Both proactive and reactive strategies should be implemented to minimize risk. These should be based on a person's individual positive behavior support plan. Overstating risks, being overly risk-averse, or using restrictive interventions carries human rights implications and can lead to unnecessary exclusion from services, stigmatization, and breakdown in relationships. Knowing the risk and having an effective risk management strategy in place is essential in supporting someone who engages in behaviors that challenge.
Thank you for watching this video. We hope you found it helpful. This video was brought to you by the Southwark Enhanced Intervention Service. For further videos in this series, please look at the Maudsley NHS YouTube channel. If you'd like any further information, please do not hesitate to contact us.